to a very fast revision of the upper limb. When we started the upper limb, the first topic we studied was pectoral region, pectoralis major, pectoralis minor, and then there was a long question over there, that was mammary gland. This mammary gland extended from second to sixth rib. There were three components of the mammary gland: skin, parenchyma, and stroma. Skin had two components, nipple and areola. Okay, parenchyma were glands. Each gland had a what was that? Dilatation before the duct. Huh? जोर से बोलो. Lactiferous glands, yeah. Lactiferous sinus. There was a lactiferous sinus. And then there was stroma. Stroma was of two types, fatty and fibrous. Fibrous stroma is called as ligaments of Cooper. Okay. In the nipple, there were two things. One was opening of these ducts and second was muscle. Muscle was of two types, circular muscle and longitudinal muscle. The areola had darkened skin, the skin which was darkened, and sebaceous glands. Darkened skin and sebaceous glands. As regards the blood supply, lymphatic drainage, venous drainage, there was only one formula you had to remember, only three words: axillary, internal mammary, and posterior intercostal. Whether it is blood supply, whether it is venous drainage, whether it is lymphatic drainage. So axillary artery, venous drainage में vein. Axillary artery के कौन से branches? Lateral pectoral, right, was the main branch. Lateral pectoral artery. Lateral thoracic artery. Okay, that's superior thoracic, acromiothoracic, and lateral. So other also were there. And the lymphatic drainage. 75% into axillary lymph nodes, 20% into internal mammary lymph nodes, and 5% into posterior intercostal lymph nodes. That was the anatomy of the internal mammary gland. The applied anatomy was amastia. Then investigation is mammography. Then surgical medical problem is mastitis. Then surgical problem is mastectomy, partial mastectomy, complete mastectomy. Okay, radical mastectomy. And the last was the cancer of breast, which can spread into vertebral column via posterior intercostal vein because it communicates with the Batson's plexus. Okay. Then the next topic was axilla. Axilla boundaries, it was pectoralis major. Then there was pectoralis minor anteriorly, and then there was subclavius muscle. जोगदंड ते कोण बाहेर उभारले त्यांना आत घ्या. Subclavius muscle. Okay. And then posteriorly was subscapularis. Then posteriorly was teres major, and posteriorly was latissimus dorsi. So this formed the posterior boundary of the axilla. Anterior boundary was formed by 3, posterior boundary was formed by 3. Subscapularis, teres major, and latissimus dorsi. Medially were 3 structures. One was ribs, upper four ribs, then intercostal muscles, and serratus anterior. Anteriorly 3, posteriorly 3, medially 3. Medially is ribs, upper 4 ribs, intercostal, and serratus anterior. Laterally also 3. Intertubercular area, tendon of biceps brachii, long tendon, and coracobrachialis. Okay. And then there was axillary artery. Axillary artery crosses the outer border of the first rib, becomes continuous with the brachial artery at the lower border of teres major muscle. Lower border of teres major muscle. That is what axillary artery was. This axillary artery was divided into three parts, but the pectoralis minor. First part had one branch. Second, that was superior thoracic. Second had acromiothoracic, lateral thoracic. Third had superior, anterior and posterior humeral, circumflex humeral and subscapular artery. 5 branches. उसी एक्सिला में there was infraclavicular part of brachial plexus. Brachial plexus was C5, C6, C7 formed by anterior primary rami of C5, C6, C7, C8 and T1. Okay, RTDC, Rajasthan Roots Development Corporation, roots, trunks, divisions and cords. So roots of C5, C6 unite. C7 is single, उसको कोई है ही नहीं जिंदगी में. C8 and T1. So these are roots. They unite to form trunks. Upper trunk, middle trunk, lower trunk. Each trunk gives division. Anterior, posterior, anterior, posterior. Okay. So posterior divisions of all the three unite to form posterior cord. Okay. Posterior divisions of all the three continue. Anterior division of the lower trunk continues as medial cord. Okay, as medial cord. और ये जो दोनों है, the anterior divisions of the upper two trunk continues as lateral cord. Okay, so सबके जो posterior division है एक साथ आके posterior कॉर्ड फॉर्म करते हैं. पोस्टीरियर कॉर्ड का न्यूमोनिक है अल्नार, ULNAR. दिस कंटिन्यूज एज रेडियल, अपर सबस्कैपुलर, लोअर सबस्कैपुलर, नर्व टू लैटिसिमस डोर्सी, एक्सिलरी. द लैटरल कॉर्ड इज LML, lateral pectoral, then musculocutaneous and lateral root of medial. Medial cord is M4U. So U is the continuation, ulnar nerve. U is the continuation, ulnar nerve. M4, medial cutaneous nerve form, medial cutaneous nerve forearm, medial pectoral, and medial root of medial, and medial root of medial. So medial pectoral, medial cutaneous nerve arm, medial cutaneous nerve forearm. So that is how the brachial plexus is formed. Going ahead with the major nerves which are there of the brachial plexus, starting with the radial nerve. Okay, the radial nerve is formed by the union of posterior divisions. It's a continuation of posterior cord. So when we talk about radial nerve, it is continuation of the posterior cord. Continuation of posterior cord, root value is C5 to T1. C5 to T1. Okay. This radial nerve has a following force. In the axilla, it is posterior to axillary artery. Posterior to axillary artery. Then, so जो axillary artery के जो हम diagrams बनाते थे, हमारे famous diagrams अगर आपको याद है, तो सेकेंड पार्ट, थर्ड पार्ट ऐसे हम लोग निकालते थे. तो सेकेंड पार्ट, थर्ड पार्ट, तो एक्सिलरी आर्टरी हम लोग निकालते थे ऐसे, राइट, एक्सिलरी आर्टरी. और उसके अराउंड लैटरली इज मीडियल नर्व, medially is ulnar nerve, posteriorly is radial nerve. वही in the second part, medially is lateral cord, posteriorly is posterior cord, and medially is medial cord. Medial cord continues as ulnar, posterior as radial, lateral as medial. So it is posterior to the axillary artery, third part of axillary artery. Then it leaves the axilla by passing through lower triangular space. Oh, lower triangular space. तो वो एक हमारा फेवरेट डायग्राम है ट्रायंगुलर स्पेसेस का, राइट. तो हम ऐसा स्कैपुला निकालते हैं, यहाँ पे ह्यूमरस निकालते हैं, So this is teres major, this is teres minor, this is triceps. तो यहाँ पे है radial, यहाँ पे है axillary quadrangular में. So leaves it by passing through lower triangular space. Then it passes through radial groove, right? Lower triangular space, radial groove. Then it is the lateralmost structure in the cubital fossa. Okay, lateralmost structure in the cubital fossa. Then it leaves the cubital fossa and becomes a thin nerve and gives a major branch called as posterior interosseous nerve, which supplies the extensor compartment. So lower triangular space, radial groove, and the lower triangular space, radial groove, and then it continues in the forearm. Okay, lateralmost structure in the cubital fossa and then continues in the forearm. And its main continuation in posterior interosseous nerve. So in the radial groove, before the radial groove, it gives two branches. Branch to the medial and the long head of triceps. Medial and long head of triceps and posterior cutaneous nerve of arm. In the groove, it gives branch to the medial head of triceps and lateral head of triceps. Medial head also supplies anconeus. And it also gives two cutaneous branches. What are the two cutaneous branches given by the radial nerve in the cubital fossa? Posterior cutaneous nerve of forearm and lower lateral cutaneous nerve of arm. So that is about the radial nerve. Applied anatomy of radial nerve. It can get damaged in the radial groove, which can lead to wrist drop because these extensors are paralyzed. Posterior interosseous nerve supplies the extensions. This is continuation of this. Then the next nerve is median nerve. Okay. This median nerve, it's formed by medial root of median, whose root value is C8 and T1. So I'll write lateral root of median here plus C5, C6, C7 and C8, T1. So this is medial root of median, this is lateral root of median, together it unites to form the median nerve. So median nerve also root value is C5, C6, C7, C8, T1 like radial, but this is from posterior division, this is from anterior division. Okay. This median nerve, it lies in the arm, it gives few branches in the arm just towards the end of the arm. Okay, no branches in axilla. In the arm, it gives few branches like nerve to pronator teres and all. They arise in the arm actually. And main supply is in the forearm. Okay, main supply is forearm. So therefore, this nerve is also called as laborer's nerve. So forearm, if this is the superficial compartment, suppose this is the deep compartment and this is the superficial compartment. In the superficial compartment, it supplies pronator teres, it supplies flexor digitorum superficialis, it supplies palmaris longus, and it supplies flexor carpi radialis. For the deep compartment, it gives a branch called as anterior interosseous nerve. So posterior interosseous nerve is a branch of radial, anterior interosseous nerve is a branch of median nerve. This supplies flexor pollicis longus, it supplies the lateral half of flexor digitorum profundus, and it supplies pronator quadratus. Okay. This nerve passes through the carpal tunnel and then comes out. And once it comes out, it supplies four muscles and 3.5 cutaneous. Lateral 3.5 cutaneous branches. मतलब अंगूठा, index finger, thumb, index finger, middle finger, and lateral half of ring finger. This cutaneous supply is by medial nerve. Medial 1.5 is by ulnar. But muscles only 4. It supplies lumbrical 1, it supplies lumbrical 2. Then it supplies the abductor pollicis brevis. amongst the thenar muscles. Then it also supplies opponent's pollicis. Now there was another thought process that it supplies half of the flexor pollicis brevis, but nowadays they don't put that. The superficial head was by medial. It gives one branch. It gives one branch which passes above the carpal tunnel. Okay, what is the name of that branch? Palmar cutaneous branch. Palmar cutaneous branch. The palmar cutaneous branch, which supplies the skin of the thenar eminence. Applied anatomy, एक ही applied anatomy इसका carpal tunnel syndrome. So because it passes through the tunnel, whenever there is edema, whenever there is arthritis of the wrist joint, the medial nerve can get compressed. उसमें palmar cutaneous nerve escapes this carpal tunnel syndrome because it passes above the flexor retinaculum. Above the flexor retinaculum. तो थिनार मसल्स जो है उसका वेस्टिंग होगा, ऑपोजिशन विल नॉट बी पॉसिबल, बट ये नर्व सप्लाई इंटैक्ट रहेगा ऑल्दो थिनार एमिनेंस का नर्व, बिकॉज ये नर्व कार्पल टनल के ऊपर से आती है. सो द नेक्स्ट इंपॉर्टेंट नर्व फॉर अस इज अल्नार नर्व. अल्नार नर्व, दिस अल्नार नर्व, द रूट वैल्यू इज C5, C6, sorry, it's C8 and T1. But there is C7 also additional. It is continuation of the medial cord. Medial cord, all nerves are C8 and T1. Ulnar nerve is C5, C7, C8 and T1. That C7 is communicating. C7 is for these muscles over here. This ulnar nerve, you know, it runs, it is formed from this. In the axilla, no branches. In the arm, no branches. And in the arm, it goes behind the medial epicondyle. Behind the medial epicondyle. Towards the end, lower part of the arm, it goes behind the medial epicondyle, and in the forearm, it again comes back to the anterior compartment. In the arm, so that is called as the cubital tunnel. Like this is the carpal tunnel. Here is a cubital tunnel between the two heads of flexor carpi ulnaris muscle. So in the forearm, in the deep compartment and the superficial compartment. In the superficial compartment, it supplies flexor carpi ulnaris, एक मसल. उधर 5 मसल होते हैं, उसमें से 4 मीडियन नर्व सप्लाई करती है, एक ही अल्नार नर्व सप्लाई करती है, फ्लेक्सर कार्पाई अल्नारिस. वो क्या है, कुछ लोग ऐसे कास्टिस्ट होते हैं ना, अपने ही जमात के लोगों को मदद करते हो, ऐसे वो अल्नार नर्व है. वो देखते मैं इधर कौन है, मेरा अल्नारिस किसका सरनेम है, अच्छा तुम्हें कहा, अरे मेरे भाई, अरे बाकी लोग हैं ना, मीडियन नर्व की तरह रहो, सबको सप्लाई करो. ओके, फ्लेक्सर कार्पी अल्नारिस. देन द मीडियल हाफ ऑफ फ्लेक्सर डिजिटोरम प्रोफंडस. मीडियल हाफ ऑफ फ्लेक्सर डिजिटोरम प्रोफंडस. Ulnar nerve will supply only 1.5 muscles here. One in the superficial compartment, half in the deep compartment. But it doesn't pass through the carpal tunnel, it passes above the flexor retinaculum. Above the flexor retinaculum, and supplies 15.5 muscles and only medial 1.5 cutaneous. Medial 1.5 cutaneous म्हणजे आपलं छोटं बोट, little finger, and medial half of the ring finger. When it comes to the muscles इसका याद रखना बहुत easy है. 4 palmar interossea, 4 dorsal interossea. Ulnar nerve is also called as musician's nerve. 4 palmar interossea, 4 dorsal interossea, 2 lumbricals, lumbrical 3 and 4. The medial 2 lumbricals, जिसका नाम नंबर है lumbrical 3 and 4. Then it also supplies the 4 hypothenar muscle. Okay, and adductor pollicis and the flexor pollicis brevis का deep head. और आजकल बुक्स में लिखा है कि वो फ्लेक्सर पॉलिसिस ब्रेविस को पूरा सप्लाई करते हैं. पहले ऐसा कंसेप्ट था कि इसका सुपरफिशियल हेड इज बाय मीडियन एंड डीप इज बाय बैक. दैट इज अल्नार नर्व. अल्नार नर्व व्हेन डैमेज्ड यू गेट अ claw hand. So claw hand, carpal tunnel syndrome, wrist drop, radial nerve, wrist drop. Okay, so this is about the ulnar nerve. Then we have 2 more nerves here we have two more nerves here जो कि चिंटू पिंटू है, बट आपको उनके बारे में थोड़ा सा मालूम होना चाहिए। उसमें से एक है एक्सिलरी नर्व। तो एक्सिलरी नर्व इज root value is C5, C6. It is branch of posterior cord. So from the posterior cord it arises in the axilla. It is posterior to the axillary artery, leaves the axilla by passing through the quadrangular space, and then enters the substance of the deltoid. Enters the substance of deltoid, and before that, in the quadrangular space, it divides into anterior branch and posterior branch. Now suppose this is the humerus. Okay, this is the humerus, and suppose this is the deltoid muscle. These are deltoid muscle. Okay, so anterior branch जो है, sorry, I should have used another color for deltoid. Okay, so this is the deltoid muscle. This is the anterior part and this is the posterior part. So इसकी जो anterior branch है, so this is axillary nerve. इसका anterior branch is accompanied by posterior circumflex humeral artery. This is posterior branch which also bears a pseudoganglion, and this nerve also supplies teres minor. It also supplies teres minor. Axillary nerve supplies the deltoid muscle and teres minor, and it also continues, this posterior branch continues as upper lateral cutaneous nerve of arm, which supplies the skin over the lower half of deltoid. Because skin over the upper half of the deltoid is by supraclavicular, lateral supraclavicular. Okay, so that is the axillary nerve, supplies two muscles, deltoid and teres minor. Okay, this axillary nerve, applied anatomy is घड्याळाकडे बघितलंस आता, बघितलंस की नाही? This axillary nerve is frequently damaged during injections on the deltoid. So injections of the deltoid have to be given in the tail of the deltoid, not above. If you are given above, then there is a chance that axillary nerve can get damaged. And the next is the musculocutaneous nerve. Next is musculocutaneous nerve. This musculocutaneous nerve is branch of the lateral cord, so its root value is C5, C6 and C7. It passes from axilla to arm. Its main supply is in the arm. In the arm, it supplies the three muscles: biceps brachii, thoracobrachialis, and and which is the third muscle in the arm? Brachialis. And in the forearm, it continues as lateral cutaneous nerve of forearm. In the forearm, it continues as lateral cutaneous nerve. Arm में muscle, forearm में skin. Arm में muscle, forearm में skin. So this is the musculocutaneous nerve. Okay, with that we cover all the nerves of the upper limb, and then there is one more question that is asked in the exam, and that is cubital fossa. Suppose this is the lateral side, this is the medial side. Medially is the lateral border of pronator teres. Laterally is the medial border of brachioradialis. Superiorly is the imaginary line joining the two epicondyles, and the floor is formed medially by brachialis and laterally by supinator. Roof is formed by skin, so apne friends, skin, superficial fascia, bicipital aponeurosis, medial cubital vein, and structures from medial to lateral side. Medial most is a nerve, lateral most is a nerve, then there is axillary artery, and then there is the biceps brachii tendon. So medial nerve, and the brachial artery, biceps brachii, and radial nerve is the lateral most structure. ये है हमारा क्यूबिटल फोसा. इसका डायग्राम आप मीडियल नर्व के लिए निकाल सकते हो, इसका डायग्राम आप रेडियल नर्व के लिए निकाल सकते हो, इसका डायग्राम आप ब्रेकियल आर्टरी जैसा गंदा क्वेश्चन अगर पूछा गलती से तो उसके लिए भी निकाल सकते हो. इसके अलावा आपको क्या ब्रेकियल आर्टरी क्या लिखोगे? टर्मिनल ब्रांच जैसा रेडियल नर्व, अल्नार नर्व, रेडियल आर्टरी, अल्नार आर्टरी. फिर then there is nutrient artery to the humerus, then superior ulnar collateral, inferior ulnar collateral. Echo. Medial nerve processes from lateral to the medial side. Then comes the most important likely questions, that is shoulder joint. उसके पहले आता है शोल्डर गर्डल. आपको एग्जाम में शोल्डर अगर लॉन्ग क्वेश्चन में दिखता है तो 5 बार ऐसा ऐसा करने का देखने का, गर्डल है या जॉइंट है, गर्डल है या जॉइंट है. अगर शोल्डर गर्डल पूछा तो then you are going to write that this shoulder girdle is made up of 2 joints, acromioclavicular joint and sternoclavicular joint. Sternoclavicular joint is a saddle variety. It's a compound variety because more than 2 bones are involved, because first rib is also involved. It is also complex variety. It is also complex variety because there is an articular disc. So sternoclavicular plus acromioclavicular makes the shoulder girdle. फिर आपको एग्जाम में पूछा जाएगा कि ये शोल्डर गर्डल का मूवमेंट्स क्या है. तो शोल्डर गर्डल का जो मूवमेंट्स है वो एलिवेशन ऑफ स्कैपुला, डिप्रेशन ऑफ स्कैपुला, प्रोट्रैक्शन ऑफ स्कैपुला, रिट्रैक्शन ऑफ स्कैपुला, एंड फॉरवर्ड रोटेशन ऑफ स्कैपुला एंड बैकवर्ड रोटेशन ऑफ स्कैपुला. So elevation of scapula is caused by levator scapulae. It is formed by trapezius. Elevation of scapula, depression of scapula. Elevation, depression, elevation, depression. Medial end of clavicle पे उसका axis है, anteroposterior axis, anteroposterior axis. Okay, anteroposterior axis. Depression, anteroposterior axis at the medial end of clavicle. Depression is caused by anatomy, physiology, and biochemistry. Depression is caused by gravity. Depression is caused by gravity. फिर बाकी एक्शन क्या है? प्रोट्रैक्शन एंड रिट्रैक्शन. इसका एक्सिस कैसा है? वर्टिकल एक्सिस है. वर्टिकल एक्सिस पासिंग एट द मीडियल एंड ऑफ द क्लैविकल. तो यहाँ पे ऐसा एक्सिस है, उसके प्रोट्रैक्शन रिट्रैक्शन, प्रोट्रैक्शन रिट्रैक्शन. Protraction of the scapula is brought about by the muscle which is responsible for pushing and punching, the serratus anterior. Then pectoralis minor muscle. Retraction is brought about by rhomboids, middle fibers of trapezius. Rhomboids and middle fibers of trapezius. Trapezius इतना जान लगा के सिखाया था मैंने. Upper fibers along with levator scapulae cause elevation, middle fibers along with rhomboids cause retraction, lower fibers along with upper fibers and serratus anterior cause forward rotation of scapula. So that's the next 2 actions. So elevation, depression, protraction, retraction, forward rotation and backward rotation. Okay, so forward rotation of the scapula, उसका एक्सिस along the clavicle है. भार्गवी क्या हो गया? हेवी हो रहा है. Forward rotation of the scapula is brought about by upper and lower fibers of trapezius, upper and lower fibers and serratus anterior. And the backward rotation is brought about by gravity. So हे कधी होतं फॉरवर्ड रोटेशन स्कॅप्युलाचं? ड्यूरिंग ओवरहेड एबडक्शन ऑफ द शोल्डर जॉइंट. बिकॉज स्कैपुला ऐसा है, ह्यूमरस का हेड ऐसा है, तो जब ओवरहेड एबडक्शन होगा तो ये फिसलेगा. इसके लिए फॉरवर्ड रोटेशन, बैकवर्ड रोटेशन. सो elevation, depression, protraction, retraction, forward rotation and backward rotation. With that we move on to the next, that is shoulder joint. Shoulder joint, ball and socket joint, okay, where stability is compromised for mobility. Okay, हमारा glenoid है, glenoid के around glenoidal labrum है, head of humerus है. Okay, there is capsule plus 4 ligaments. Capsule plus 4 ligaments. So capsule is attached to the glenoidal labrum and then it is attached to the anatomical neck, and at the neck of the humerus it goes down to the surgical neck. The ऊपर anatomical neck है लेकिन नीचे के पार्ट में surgical neck पे चला जाता है, and therefore inferior dislocation is very common. So एक है capsule, बरोबर. दूसरा है ग्लिनोह्यूमरल लिगामेंट्स. 3 ग्लिनोह्यूमरल लिगामेंट होता है, 1 2 3, सुपीरियर, मिडल, इंफीरियर. ग्लिनोह्यूमरल लिगामेंट्स. शोल्डर जॉइंट में देयर आर 3 ग्लिनोह्यूमरल लिगामेंट्स. देन transverse humeral ligament. Transverse humeral ligament. It just runs from lesser tubercle to greater tubercle and plasters the biceps brachii. And plasters the biceps brachii. So that superiorly the joint is stable. Transverse humeral ligament. And then it's coracohumeral ligament. Coracohumeral ligament. From root of corpus process to the humerus, neck of the humerus, and glenoidal labrum. So capsule plus 4 ligaments. Capsule plus glenohumeral, then transverse humeral and coracohumeral. तो याद क्या रखना है आपको वर्ड ह्यूमरल. कैप्सूल प्लस ग्लिनोह्यूमरल, 3 ग्लिनोह्यूमरल, फिर ट्रांसवर्स ह्यूमरल, फिर coracohumeral and glenoidal labrum. Okay, इसका nerve supply is mainly by the axillary nerve. Axillary artery is the blood supply. इसके actions है flexion, extension, okay, abduction, medial rotation, lateral rotation. Okay, इसका applied anatomy, dislocation of the shoulder joint, which is more common inferiorly and damaging the axillary nerve, which is at the surgical neck of the humerus. So उसका applied anatomy fix है. और कुछ लिखना है, 2 मार्क के लिए आया तो frozen shoulder. Supports of the shoulder joint क्या है? एक तो thoracoacromial arch which acts like a secondary socket. दूसरा rotator cuff. ये जो आगे क्या है? subscapularis. ऊपर क्या है? supraspinatus. इधर क्या है? infraspinatus. पीछे क्या है? teres minor. तो ये 2 लोग पीछे, एक ऊपर, एक आगे सपोर्ट करते. वापस inferiorly there is no support, so inferior dislocation. ओके, मैंने भी आपको जब पढ़ाया था ना, उसके बाद मैंने बगैर पढ़े, मैं मतलब क्या घर पे गया, सोया, उठा, बोला अच्छा पर मुझे लगा आप सब लोग पढ़ के आए रहेंगे, तो आपके भरोसे पे आया हूँ मैं. फ्लेक्शन, सो फ्लेक्शन ऑफ द शोल्डर जॉइंट is formed by the clavicular head of pectoralis major. बरोबर क्या है? clavicular head of pectoralis major. अजून काय? शॉर्ट हेड ऑफ बाइसेप्स थोड़ा सा मदद कर सकते हैं. एक्सटेंशन लैटिस्मस डॉर्साई. ये हमारे जो ये 3 फ्रेंड्स है, लैटिस्मस डॉर्साई, देन लेडी बिटवीन 2 मेजर्स, टेरिस मेजर एंड पेक्टोरालिस मेजर. पेक्टोरालिस मेजर का जो स्टर्नोकॉस्टल हेड है, दैट विल कॉज एक्सटेंशन. यही तीनों क्या कॉज करेंगे? एडक्शन. यही तीनों क्या कॉज करेंगे? मीडियल रोटेशन. लैटिस्मस डॉर्साई, टेरिस मेजर, पेक्टोरालिस मेजर. ये 3 एक्शंस तो ये लोग ही करते हैं. एडक्शन, मीडियल रोटेशन, एक्सटेंशन. 3 मसल्स कॉमन है. अभी बचा एबडक्शन. एबडक्शन का तो अपना मेन डेल्टॉइड सुप्रास्पाइनेटस. ओके, सो फ्लेक्शन is anterior fibers of deltoid. Okay, it is also the clavicular head of pectoralis major. अभी lateral rotation, short lateral rotators. कौन है short lateral rotator? Teres minor and infraspinatus. Teres minor and infraspinatus. Okay. Then there are 3 more joints. उसमें से एक है एल्बो. एल्बो क्या है? कॉम्प्लेक्स हिंज, कॉम्प्लेक्स कंपाउंड हिंज, because more than two bones are there. बरोबर. तो ये है उसका लोअर एंड. देन यहाँ पे ट्रोक्लियर नॉच, यहाँ पे है कैपिचुलम, तो यहाँ पे है अल्ना, यहाँ पे है रेडियल हेड. ओके, हाँ, दिस इज हाउ इट इज. एकदम मस्त है क्वेश्चन लिखने के लिए. ऑन फ्रॉम द लैटरल साइड, फ्रॉम द मीडियल साइड there is ulnar collateral ligament. Ulnar collateral ligament which has 3 bands: anterior band, posterior band and oblique band. Ulnar collateral ligament has 3 bands. What are they? Anterior, posterior and oblique. Oblique connects it. So anterior, ulnar collateral ligament. Laterally is radial collateral ligament. Collateral epicondyle से arise होगा. The beauty of this is it doesn't get attached to radius. यहाँ पे एन्युलर लिगामेंट होता है, वो एन्युलर लिगामेंट को अटैच होता है. लैटरल, द रेडियल कोलैटरल लिगामेंट इज नॉट अटैच्ड टू रेडियस, इट इज अटैच्ड टू द एन्युलर लिगामेंट. सो दैट एन्युलर लिगामेंट के अंदर रेडियस का हेड मूव होना जरूरी है. सो कैप्सूल प्लस 2 लिगामेंट्स. इसका अप्लाइड एनाटॉमी आ गया तो एल्बो वर्ड याद रखने का. एल्बो जॉइंट का अप्लाइड एनाटॉमी इज एल्बो. सो टेनिस एल्बो lateral side पे, golfer's elbow medial side पे, student elbow, minor elbow. खाली elbow word याद रखो. हाँ. Then there is the radio-ulnar joint. ये एकदम first class question आता है. Radio-ulnar joint, superior and inferior radio-ulnar joint, pivot variety. थोड़ा सा लिखो आप कैसे फॉर्म होता है. ऊपर है रेडियल हेड, नीचे है अल्नार हेड. Radial head, ulnar notch, ulnar head, radial notch. Okay. Axis passing from head of radius to head of ulna, head of radius to head of ulna, oblique axis. तो उस axis पे radius moves over the ulna during pronation and supination वो normal पे आ जाता है. Pronation caused by pronator teres and pronator quadratus. Supination is caused by supinator and biceps brachii. Sweeney. Supination is caused by supinator and the bicep brachii, which is a strong supinator in mid-flex position. In the extended position, supinator is the one which causes supination. So that is about the radio-ulnar joint. उसके बाद आता है wrist joint. Wrist joint is ellipsoid variety. Ellipsoid variety, उसका ulna doesn't participate in the wrist joint. So main is radius. Radius है. और ये अल्ना का जो हेड है उसके ऊपर एक आर्टिकुलर डिस्क होता है. तो वो इंफीरियर रेडियो-अल्नार जॉइंट का आर्टिकुलर डिस्क. हाँ, तो इसके लिए दैट आर्टिकुलर डिस्क पार्टिसिपेट. फिर यहाँ पे आपने 3 मत दिया है. स्कैफोल्ड लूनेट ट्राइक्यूटरल आगे के साइड पे. एलिप्सॉइड जॉइंट, उसका कैप्सूल. देन देयर इज again 2 lateral ligaments, medial collateral and anterior radiocarpal, posterior radiocarpal, anterior radiocarpal, posterior. इसमें भी 5 लिगामेंट. एक है कैप्सूल, then medial collateral, lateral collateral and anterior radiocarpal going from radius to these 3 bones and posterior radiocarpal. इसका एक्शन है फ्लेक्शन, एक्सटेंशन, अबडक्शन, अडक्शन. 4 ही एक्शंस है. ये तुम लोग जो ऐसा करते हैं ना, दैट इज कॉम्बिनेशन ऑफ 4. फ्लेक्शन कॉज्ड बाय सारे हमारे फ्लेक्सर का अल्नारिस, फ्लेक्सर का रेडियलिस, एक्सटेंशन, सुपरफिशियलिस, सब. एक्सटेंशन का अल्नारिस, एक्सटेंसर डिजिटल, एक्सटेंसर का रेडियलिस, लॉन्गस, एक्सटेंसर का रेडियलिस, सब कुछ. अडक्शन, हाँ, अडक्शन इज कॉज्ड बाय बोथ अल्नारिस, फ्लेक्सर का अल्नारिस, एक्सटेंसर का. अबडक्शन कॉज्ड बाय बोथ रेडियलिस, flexor carpi radialis, extensor carpi radialis longus and extensor carpi radialis brevis. और इतना सब आप पढ़ने के बाद एक जॉइंट वो पूछते हैं, उसका नाम है wrist joint. Wrist joint में सॉरी फर्स्ट कार्पो मेटाकार्पल जॉइंट. फर्स्ट कार्पो मेटाकार्पल जॉइंट. ओ सैडल वैरायटी. फर्स्ट कार्पो मेटाकार्पल जॉइंट इज सैडल वैरायटी. सैडल वैरायटी. सो इट इज फॉर्म बाय व्हाट? तो यहाँ पे स्कैफोल्ड लूनेट ट्राइक्यूटरल, यहाँ पे ट्रेपेजियम, बरोबर कि नहीं? ट्रेपेजियम एंड हियर इज फर्स्ट मेटाकार्पल. उनके बीच में ये होता है. तो उसमें कुछ नहीं है. कैप्सूल है, एंटीरियर लिगामेंट है, पोस्टीरियर लिगामेंट. मेन उसका होता है एक्शन. एक्शन क्या है उसके? फ्लेक्शन, एक्सटेंशन, एबडक्शन, अडक्शन एंड जो 5वां एक्शन ऑपोजिशन. वो भूलना नहीं, 5वां एक्शन ऑपोजिशन. 5 एक्शन लिखना है. फ्लेक्शन, एक्सटेंशन. तो फ्लेक्शन, फ्लेक्सर पॉलिसिस, एक्सटेंसर, एक्सटेंसर पॉलिसिस, abduction, abductor pollicis, longus brevis. adduction, adductor pollicis एक ही है. longus brevis उधर नहीं, बाकी सब जगह longus brevis. flexor में flexor pollicis, longus brevis. extension, extensor pollicis, longus, extensor pollicis brevis. abductor pollicis, longus, abductor pollicis, adductor pollicis, opponens pollicis एक ही मसल. So that's about the first carpo-metatarcal joint. So this is the revision of upper limb we completed in 40 minutes. Thank you so much.